Endometriosis affects 10% of reproductive age women and girls globally. According to World Health Organization, that's about 190 million women and girls. It is a condition where tissues similar to the lining of the uterus grow outside of the uterus, causing pain and at times infertility in women. Today on the program, we are looking at how to manage endometriosis. Good evening, I am Olasunbo Mudukwe. Thanks for always staying with us. The program is Sound Health. It continues in a moment. Please stay tuned. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Abayomi Ajayi, Managing Director and Chief Executive Officer, Nordica Fertility Center. He's going to share his perspective on why endometriosis is still a burden in African women. Thank you so much for joining us again this evening.
Thank you for having me. It's always a pleasure to talk to you. And like you said, we'll be talking about endometriosis today. I look forward to that discussion.
All right, in simple terms, tell us what exactly is endometriosis. Let viewers know in simple terms.
Okay, yes, in simple terms, endometriosis happens when the lining of the uterus, that is the part of the uterus that is shed every month in the menstrual period, now occurs in any other place apart from that normal lining. If you allow me, I have a diagram of the uterus here, okay? The inner lining is here, okay? That is what the woman sheds every month. Now, if for any reason it's present anywhere else apart from where it's supposed to be, commonly it could be on the ovaries or somewhere in the abdomen, and this is what we call endometriosis.
Okay, how aware are people about this, women especially, about this condition? Because the World Health Organization says about 190 million women are affected globally.
Yes, thank you so much. Sometimes when we say 190 million people look at it from the point of view, maybe they are Caucasians, okay? But what we say is that 1 in every 10 women or girls will have endometriosis anywhere in the world. So Nigeria is not, or any part of Africa is not excluded. Now, unfortunately, this awareness is not here. Not only not in Nigeria, but recently even all over the world. Many people were living with endometriosis without knowing it. And until recently, of course, again, because the way to diagnose endometriosis was doing something that we call laparoscopy, which was almost strange in this part of the world until recently. So the thing is that, and that's why all over the world, the month of March has been dedicated to be the month of endometriosis awareness, because people saw that it was taking between 8 to 12 years between onset of symptoms and the diagnosis of this condition in developed world, parts of the world. But in Africa, a majority of our women were just not, the diagnosis was not made at all. I remember about 20 years ago, diagnosis was hardly made in Africa at all. It was only the few women who were lucky enough to go to the UK or the US that got to know that they had endometriosis. For us, most of the women here who had endometriosis were either treated for other things or everybody was just clueless.
All right, is this condition the same as fibroid? If you ask many people, they will tell you, is it not fibroid? How do you tell the symptoms? How do you differentiate between this condition and fibroid or any other condition related to women's menstrual cycle?
Fantastic. Yeah, I think that's one of the problems that endometriosis has, because, you know, when you have symptoms that are similar to a condition that is very well known, people tend to ascribe everything to fibroids, but they're different, completely different. If actually one is supposed to want to have one, if you had a choice to choose between fibroids and endometriosis, I think I'll even choose fibroids, because fibroids is easily, everybody understands it, it's easily treated. Once you either remove it or you do something that will take care of it. But it's different from endometriosis that you have to live with throughout your life. And that's why even understanding endometriosis is very much important. But the symptoms might look alike sometimes, But really, endometriosis, the effect on the quality of life for women who have it is more profound than even fibroids, because many of these women have to live with pain, okay? Pain that even many people don't understand why you're going through the pain, because unlike fibroids where you can see that there is something going in the abdomen, this is, you look at the abdomen and everything seems to be okay, you know? Sometimes you even do a scan, everything seems to be okay. So and that is the dilemma that many of these women go through, because we always say that they have this, they are misunderstood, they are misdiagnosed, and usually most of the time mistreated. So it's the symptoms are pain, like I said, and infertility. Now this pain can cut across from having menstrual pain, very bad menstrual pain, to when you have intercourse, you have a lot of pain, to when you are urinating, you have a lot of pain, to when you are defecating, you have a lot of pain. So this pain can be, and sometimes the pain is just there all the time. So some of them also can bleed from irregular sites. For example, you can see a woman bleeding from the navel or the belly button. You know, sometimes you can see somebody coughing out blood, you know, and people think it's tuberculosis, you know, to infertility, inability for them to be able to conceive when they want to have children. So this can be the plethora of symptoms that they can have. And that's what makes it very confusing, even for the doctors and even for the women who have endometriosis.
Okay, from your explanation, it is obvious that it is not normal to experience pain while during your monthly cycle, because some of the myths surrounding the menstrual cycle is that you must experience pain, you must experience discomfort. Is that true?
Yeah, you could experience some discomfort, but it's not enough to stop you from doing your normal chores. You know, what we say to women is that once you have your menstrual period, the pain from your menstrual period is disturbing you from your normal chores. You can't function. You know, there's some ladies, when they are menstruating, they can't go to school, they can't go to work, they can't do anything. Why you see other people, they are menstruating, yes, they just, if they have any pain at all, they just take paracetamol and they're up and about. You know, there's a difference between the two. You know, so if your pain is enough to disturb you from doing your normal chores, then you must see a doctor. You must see a gynecologist. Do not rest until we know exactly what's causing that pain.
All right. So, are there risk factors to watch out for in this when experiencing this condition?
Yes, there are risk factors. I'm happy you didn't ask me what causes it, because we really don't know what causes endometriosis. But just like you said, that there are risk factors. Okay, there are risk factors. There are people, you know, the first risk factor, of course, which we must address is the family history. You know, if your sister has the endometriosis or your mother has endometriosis, then you run a higher risk of having endometriosis. Okay, we know that people also if you have your diet also could predispose to endometriosis, you know. So, but what we say is that the majority of the things is hormones and your genes, okay? So people who are also using OCP or oral contraceptive might be more predisposed to endometriosis. So those are some of the risk factors that we can look at. And of course, like you said, the diet. It's better for you to eat healthy. Exercise is also, moderate exercise is good for you. And then, so those are some of the risk factors that you can, but we don't know what causes endometriosis. Why does a woman have it? And this other one does not have it. It's still what we don't know.
Okay, if we don't know the causes of endometriosis, is it treatable? Can it be treated?
Yeah, unfortunately, it can be. Yeah, I like the question you asked is, can it be treated? It can be treated, but it cannot be cured. They're two different things. Okay. We can manage endometriosis, but we cannot cure endometriosis. So that's why I said, if you have endometriosis, something you have to live with throughout your life. So it's better you understand it. It's better you be able to control it, and that's by managing it. And usually either you are on some analgesics for a very long while, or you are on some hormonal drugs, or sometimes you are even having to contend with the inability to have children, which might sometimes require that you do things like IVF and stuff like that.
Okay, it's still not encouraging to know that it is an unrecognized burden in African women. How do we make women more aware? How do we change this narrative?
Yes, I think you said it. The first thing is awareness. Unless you know, it can be staring you in the face, and still you don't know what you have, But once we know, then it's easier for us to be able to tackle. You can imagine some people that every month their life stops and they still don't know what is wrong with them. They go to the doctor says, well, I can't find anything. Maybe it's in your head, And so for them, it's easier when you know that, look, this is what I'm battling. What are the decisions I need to make, for example? Just yesterday, we had a 16-year-old who had with laparoscopy for endometriosis for 16, And it's changing in Nigeria too. We're beginning to see younger people, unlike before that is in their 30s and so on and so forth. Because of the awareness now, people are beginning to know, okay, this is endometriosis. What do I need to do about this? Do you need to freeze your eggs if you don't have a partner? Those are some of the decisions that you might need to make. So first and foremost is awareness, not only for the doctors, but also for the general public, so that the doctors, the caregivers are more aware. And that's what we've been doing every year to bring doctors together, talk about endometriosis. We've been doing that since 2005, and I think it's definitely yielding a lot of fruit, because we're seeing now, unlike before, that majority of the patients who are not diagnosed, we're seeing more and more people diagnosed with endometriosis now.
Okay, so apart from changing the narrative, you mentioned in your response earlier that it causes pain. Apart from pain, let's look at infertility, and endometriosis. Does endometriosis impact or impair causes infertility in women?
Yeah, it's one of the commonest causes of infertility, unfortunately, because when you have, you don't forget what we describe the endometriosis to be. There is the presence of the endometrium, or the inner lining of the uterus, where it should not be. So it's like wherever it is, it's like every month, just like a woman bleeds, wherever what we call them implants, wherever they are, they also bleed. So imagine it's in the abdomen. So what happens is that over time, she's like a woman is bleeding into her abdomen every month. So after a while, what happens is that the body tries to control that by surrounding it and fencing it off. And so you can imagine if it disrupts the anatomy in the abdomen, and therefore the anatomy of the tube, the reproductive system is disrupted, and therefore causes infertility, either because of the anatomy being disrupted or the mere fact that there is blood even in the abdomen, which makes the general milieu to be not conducive for both the egg and the sperm. And even after fertilization, for the embryo to implant into the uterus becomes much more difficult. So that's why we say that endometriosis tends to affect almost every aspect of fertility in women. So it does affect fertility. In fact, 40 to 50% of women with endometriosis also have infertility.
All right, your call to action, Dr. Ajayi, as we wrap up this segment. What advice do you have for women, girls, fathers, relatives? Because it takes a village to raise a girl child or a family. What advice do you have for women and girls out there?
Well, yes, thank you. I will advise women and girls, but also the government needs to get it. All right? Because this fight is beyond what one person can fight. It's beyond what individuals can fight. The government needs to understand what you said, 190 million women.
Million.
How many are in Nigeria? If you can look at 1 in 10, how many women are we talking about in Nigeria? So the government needs to get involved. So, but for the women and the girls first, the first thing is that we were saying that if your menstrual pain disturbs you enough that it disturbs your chores, go see a doctor. Let's start from there. There is nothing wrong in you asking your practitioner, doctor, do you think I have endometriosis? There's nothing wrong with that, you know. So once we get that, then also for men, for mothers, for them to be aware that there's a condition called endometriosis, that is not as if the girls are loafing around. You can imagine you have 4 daughters. If 3 of them menstruate and there is no problem at all, but one, anytime she's menstruating, the whole world comes to a halt. And then if you're not careful, you want to black label that kind of girl. And so that makes it very difficult for this girl. So you can see somebody is going through this pain, but emotionally also, you are not helping her. So it becomes a double whammy. It becomes a double whammy for such people. So it's very important for us that women also understand, men understand that their wives might, why sometimes, you know, why their wives might not be interested in having intercourse sometimes because of the pain that they're going through. And then also the doctors need also to understand more that there is this condition called endometriosis that they might need to look at more for. And government also has to help with dedicating money and training centers for doctors to be able to, not only doctors, nurses, psychologists, pathologists to be able to train in order to be able to look after these special women.
All right, and I wish you all the best on this journey, Dr. Ajayi. Thank you so much for your time and resources on the program.
It's always a pleasure to be with you. Thank you so much for inviting me.
All right, thank you so much. You're welcome. Hopefully the narrative will change. Pain experienced by that lady or woman is not an excuse to avoid chores or go to work. Show love, show care to every woman out there. This is where we say thank you on this segment. I have been speaking with Dr. Abayomi Ajayi, the Managing Director and Chief Executive Officer, Nordica Fertility Center, on how to managing endometriosis. Sound Health continues with trending health news. Please stay tuned. have time for today on Sound Health. Remember, endometriosis is real and it is not an excuse for a woman or girl to stay away from work or avoid chores. Show love and care to every woman around you. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.